and welcome to the National Emergency Operations Center COVID-19 weekly briefing for Wednesday, 29th September 2021. I am Lesroy Williams. Thank you very much for joining us for our briefing today. We continue to update you on what is happening in the Federation of St. Kitts and Nevis in relation to the COVID-19 pandemic. We are all in this fight together, and each one of us is called to play his or her part in this fight. And all of us, through an extensive education campaign on the non-pharmaceutical measures and the pharmaceutical measures, which is the vaccine, we are all aware that each of us has a very vital role to play in bringing this pandemic to an end and putting our country back to a state of near normalcy or normalcy. And so we continue to have these press briefings because we understand the importance of providing you with information that is key to the management of the COVID-19 pandemic. Today, I will be having some special guests today at our briefing, and they are from the Pan American Health Organization, what is known as PAHO, and also the World Health Organization, who will be making some presentations today. And of course, you will have your opportunity as well to send questions so that they can answer. And so I have with me Dr. Darlene Omer, who is PAHO advisor and the Family and Community Health, and Dr. Milton Britton Barillas, who is pediatrician and PAHO WHO technical advisor for the COVID-19 rollout. They are here in St. Kitts, working along with the Ministry of Health, and we welcome them to this press briefing. In order, I would like to invite to the podium to speak to us on the regulations, the COVID-19 regulations, with specific reference to the statutory rules and orders. I want to invite Superintendent Cromwell Henry, who is also a member of the National COVID-19 Task Force. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. Today I will speak to you specifically on the operations of bars, because what we have seen at some of these establishments is dangerous to the health of the patrons, and so my presentation will be geared towards making an appeal to both the patrons and operators of these establishments to think health first. The COVID-19 Prevention and Control Act sets out how bars should operate. Section 13.2 gives specific guidelines as follows. A bar may be opened for the sale of liquor in accordance with the provisions of the Liquor Licenses Act. All persons shall adhere to social distancing and physical distancing protocols. All persons shall adhere to the hygiene protocols. No more than 8 members of the same household should be in close proximity to each other. No more than 2 persons who are not from the same household shall be grouped together or share a table. Spacing between tables at a bar or other seating arrangement shall allow for a minimum of 6 feet between persons. All persons shall wear a face mask covering their nose and mouth, except when eating or drinking. The owner or operator of a bar who contravenes these provisions commits an offense and shall be liable on summary conviction to a fine not exceeding $10,000 or to the closure of the business or establishment or to both. Notwithstanding this, a police officer or a member of a compliance team may issue a fixed penalty notice, or what we call a ticket, to the owner or operator of the bar who contravenes these provisions. In other words, the owner or operator of the bar is responsible for ensuring that the patrons comply with these provisions and that the bar is set out in a way that compliance is easily achieved. Given the high incidences of new COVID-19 cases, it is important and necessary that these regulations are adhered to and enforced. We are all well aware that the virus is transmitted mainly through close person-to-person contact. Enclosed and crowded bars are ideal places for transmission of the virus, especially when the majority of persons in these environments are not wearing masks. We therefore appeal to everyone to consider your health and those around you and avoid crowded places. Wear your mask when you are in public and practice good hygiene habits. The police will be closely monitoring these establishments and will take appropriate action as provided by the law to ensure compliance. Thank you.
Thank you very much, Superintendent Henry. I want to acknowledge the Honorable Wendy Phipps, the co-chair of the Mitigation Council, who has joined us. Additionally, I would like to recognize the PAHO country representative here in St. Kitts and Nevis, Ms. Katrina Smith. I now invite Dr. Marissa Carty, who is filling in for Dr. Hazel Laws, our Chief Medical Officer. She is the Public Relations Officer at the Health Emergency Operating Committee, and she will present us today with the situation report. Dr. Carty.
Or listening. I present the Health Emergency Operating Committee Situation Report for Wednesday, September 29th. I begin by reminding us the COVID-19 virus is still in circulation in the Federation. Therefore, we are strongly recommending the adherence to the non-pharmaceutical COVID-19 protective measures and behaviors. These include wearing a face mask appropriately covering both nose and mouth, frequently sanitizing your hands with soap and water and an alcohol-based hand sanitizer, avoiding crowds and crowded environments, and maintaining a safe distance of 6 feet or more from persons with whom you interact. And if you or your child are feeling ill or have symptoms, please stay at home. You may contact your healthcare provider via phone for further instructions. These measures have been proven effective in reducing the impact of the pandemic. The Lambda variant of the virus continues to be circulated in the Federation. On Tuesday, 28th September, an additional 27 cases were confirmed, bringing the total number of cases to 1,918, with 333 in Nevis and 1,585 in St. Kitts. While 990 cases have fully recovered, we are monitoring 915 active cases, with 128 in Nevis and 787 in St. Kitts. There are currently 10 hospitalizations, 2 at the Alexandra Hospital in Nevis and 8 at the Jean France General Hospital here in St. Kitts. We have also recorded 13 COVID-19 related deaths. The following slide shows the vaccination status of the COVID-19 cases as of September 28th, with 51% of the cases not being vaccinated, 8% partially vaccinated, and 17% fully vaccinated. This indicates that the unvaccinated are most affected by this current wave. The next slide shows the cases affected by age group. Please note that this current wave is impacting persons 20 to 29 years and 30 to 39 years, our young adults, at a higher rate than the other age groups. However, the cases span the entire age range from childhood to over 60 years. As previously mentioned, we have 915 COVID-19 active cases. All confirmed cases are connected to a case manager who closely monitors their progress. It is important that each case stay connected with your case manager. If you experience any change in your condition or medical status, please reach out to your case manager immediately. Additionally, boost your immune system by eating healthy meals rich in foods that contain high levels of antioxidants, vitamins, and minerals like fruits and vegetables. Stay hydrated by drinking plain water, get enough rest, and exercise regularly. As part of the COVID-19 response, our contact tracing and testing program continues with both targeted and random testing. During the period May 19th to September 28th, approximately 33,493 samples have been processed in St. Kitts and Nevis. Now, as part of the contact tracing process, when an individual is confirmed a positive case, that person is placed in isolation and assigned a case manager. If fully vaccinated, the time to recovery may be 7 to 10 days, while an unvaccinated person may be ill for a longer period. To be deemed fully recovered, a case must receive 2 negative RT-PCR test results. Therefore, serial testing for cases is also a part of the process. Now, contacts of cases are automatically placed in quarantine. If unvaccinated, the quarantine period is 14 days. You will be tested at the start of the quarantine period and again at the end of the 14 days. Once both tests return negative, you will be officially released from quarantine. For persons who are fully vaccinated, an initial test will be done, and you will be allowed to go about your regular daily activities. However, you will be monitored for 7 days. At the end of the 7 days, a second test will be done, and if both tests return negative, you will officially be released from monitoring. So how do we move forward? This involves continuing our contact tracing efforts, which are guided by robust protocols. Persons are being asked to cooperate fully with the contact tracing team when they call. Please be honest and provide full disclosure of all the persons with whom you would have been in contact. COVID-19 testing will continue with cases being placed in isolation, either in their homes or in a government facility, and contacts of cases being asked to self-quarantine. Clinical management of confirmed cases will continue as all cases are linked to a case manager, all of whom are senior nurses. We will also continue our COVID-19 vaccination program. Now, as of the end of day, Tuesday, September 28th, 75.8% of the target population have received their first dose of the vaccine, and 67.5% of the target population have received their second dose. Now, this is the target population of the adults. For the children, 7.6% of the target population have received their first dose, while 2% have received their second dose. On Wednesday, September 1st, we began the Pfizer Biontech vaccine rollout. I would like to remind you that the vaccine is safe and effective and accessible at all health centers by appointment only. We offer universal eligibility. Therefore, persons aged 12 years and above can receive the vaccine. The vaccine regimen is 2 doses given 21 days apart. Now, some of the common COVID-19 signs and symptoms that we have been seeing here in the Federation include headache, an altered sense of taste and smell, joint pains, dry cough, GI symptoms with bouts of watery stool and nausea, cough, body aches, and low-grade fever. I close by reminding us that living with COVID-19 requires adherence to the COVID-19 protective measures, and these include accepting the vaccine, wearing a face mask, proper hand hygiene, maintaining adequate distance from others, and please stay at home when ill or ordered to do so. Let us all work together to reduce the impact of this disease. Stay safe, stay healthy. Thank you.
Thank you, Dr. Carty, for your presentation. I would now like to invite Dr. Darlene Omer, PAHO Advisor in Family and Community Health, and she would tell us their mission in St. Kitts and Nevis. Dr. Omer.
Good afternoon to all. It's really a pleasure for me to be here this afternoon. I take this opportunity to bring greetings from our PAHO WHO representative, Dr. Yictades Gebre, and our PAHO WHO director, Dr. Clarissa Etienne. It's really happy to be in St. Kitts again, and I remember this morning in one of our sessions, I mentioned to the team that I said once PAHO starts traveling again, the first place I'll go to St. Kitts and Nevis, and here I am. This is part of our continuous support that PAHO has been providing to the countries in response to the COVID-19 pandemic. And in this particular occasion, what we're targeting our mission is to address the issues related to the concerns related to vaccination. So our mission is to have some sessions with the nurses and the medical staff, sessions with the pediatricians and the people that work on the pediatrics ward. We are also we're also going to see how data is collected and how it's being registered. We're also going to look at the cold chain management. And we're also going to have at the final day some discussion on how the adverse events or associated to vaccinations are being recorded and managed. So we're kind of like going through the whole process of the vaccination program. One of the things I think I could not be here without noting is the vaccination coverage in St. Kitts and Nevis. So WHO General Director has made a challenge globally that by the end of September, all countries should have at least 10% of vaccination coverage overall. And the challenge is also that by December, all countries should have 40% overall coverage in vaccination. And the Federation of St. Kitts and Nevis on September 10th reached that target long before December. So I think this is something that is really recognizable to St. Kitts and Nevis, and that adds the last objective of our mission, to learn the strategies that St. Kitts and Nevis have been applying to see how this could support to other countries, because we know there are other countries in the Eastern Caribbean that are just coming to 10, 11%. So the other thing that I wanted to take, one we had in our discussions this morning, is some of the issues or concerns that are now public's concern in terms of vaccine hesitancy. Because having reached 40% of vaccination, which is high, moving from there is going to be challenging to get above the 40%. So we need to discuss, and we would, present the technical evidence to the staff so they could know to address the public's concerns on some of the main issues that drives vaccine hesitancy, like we know the famous question, particularly for Pfizer vaccine, why was it developed so fast? The other question as to what are the adverse or what are the main side effects, and other issues that we know come specifically on Pfizer related to DNA, etc. So this morning precisely we were able to have a very productive discussion with the nurses, presenting the technical evidence to support them in addressing these concerns with the public. So that's pretty much in a quick snapshot what we are going to do these 4 days. I must say that at the ending day, we're going to do an actual debriefing with the PS, and we would highlight some of our main findings.
So people are to be really commended for coming out and getting the jab. I now want to invite Dr. Milton Britton Berillas, who is a pediatrician and PAHO WHO technical advisor for the COVID-19 rollout, and he's going to provide us with information on the Pfizer Biontech vaccine. Dr. Berillas.
Good afternoon, everyone. And it's an honor for me being here. It's a pleasure for me being here and share with you this experience about the vaccination on children. Well, it sounds like something new, but it's not. There are many questions about this topic, but you don't have to be feared. The developed countries of United States, Canada, United Kingdom had started with the research on children using Pfizer COVID-19. Well, they have shown that there are minimal adverse reaction. The safety of the vaccines have shown that it's more benefits than the adverse reaction. What this mean? This means that for our children on the Federation, the best advice that I can do, that PAHO WH can say, is take take the vaccine. I know there is many information around the world about this. But a few days ago, WHO PAHO have given permission, the authorization to use the Pfizer COVID-19 for children up to from 12 years old and more. This is very important for us because the Federation just started with the campaign of the vaccination on children. And since that moment, I just checked that the Federation started with this campaign September 1st. Until today, there is no information about adverse reaction. What does it mean? Our children on the country, on the Federation, any kind of adverse reaction. And this is good. This is good, and this have a good relationship with the other countries, because in the other countries have shown that less than 5% of children have an adverse reaction. And from this adverse reaction, the principles are mild effects, mild adverse reaction. For example, itching, pain, dizziness, fatigue, those kind of things. They share with us that the serious adverse reaction in children are less than 1%. So that means the vaccination on children is safe. And I would like to recommend you to go to the health center, receive the vaccine for our children, for our family. It's the recommendation that I can do. I will be here for you if you have any doubt, any question, and open to share my
19 Task Force and the National Disaster Coordinator at the National Emergency Management Agency, NEMA, to give us his presentation.
Thank you, Mr. Williams. A pleasant good afternoon to all. This afternoon it has been a pleasure to have our colleagues from PAHO and also the WHO. And Mr. Williams, not taking away from your job, but allow me to recognize the Honorable Akila Byron Nisbet, who has just joined us from the Minister with responsibility for health, entertainment, and also IT. So thank you to our friends from PAHO for giving such wonderful presentation. And to Dr. Padilla, before you leave, I would like you to listen to a song by King Conwis. He says, "It must be in the water, it must be in the food." It's a very nice song that you can listen to. Right. So today I want to brief you on a number of concerns that has been brought to the attention of the National COVID-19 Task Force. One of the challenges that has been brought to our attention is the lack of cooperation in persons wearing their mask when using public transport. And in this case, we want to focus on the ferry operations. Persons, yes, they enter into the ferries with their mask, but yet when the boat takes off on its journey, persons are taking off the mask. And when they are being asked to please put on the mask, persons become confrontational and combative. I am appealing to you, citizens, residents, users of these services, to cooperate and help us in the fight against COVID-19. In discussion with the commander of the Defense Force, who is also responsible for the Coast Guard, we are going to be looking at options in which we can assist the ferry operators and those service providers in enforcing the protocols, whether Coast Guard officers may at times randomly have to be on the vessel, or police officers may go on the vessel, or the Coast Guard officers may board while at sea and provide some support to the ferry operators. Again, I want to humbly appeal to you to support us in this cause. It's challenging. Superintendent Henry would have made a passionate plea again. Many persons have called me, sent me photos of persons or bar operators, service providers within the Strip area in particular, whereby there is absolutely no adherence to protocols and there is overcrowding of bars. We want to appeal again to all of you to please help us in this fight. The quicker we can get St. Kitts and Nevis, get this crisis under control, this outbreak right now under control, the better it will be for us. I want to take this opportunity to commend the Nevis Culturama festival that would have occurred from the 16th to the 20th of September, and it would have been a virtual edition. I think Mr. Abernathy Liebert and his team did a wonderful job, and they were very compliant. Mr. Abernathy and his team would have had a number of engagements with the COVID-19 task force, and they understood the times that we were in, and they took the necessary precautions to ensure that we have a successful virtual Culturama COVID-19 task force, and we will have some further engagements with the National Carnival Committee and how we can have a virtual, maybe carnival or whatever activities we can have in a safe manner. We have also received submissions from the entertainment sector. The Ministry of Entertainment would have engaged so that we can collaborate and deliberate on the submissions for the restart of the entertainment sector. Equally so, the sporting sector has already reached out as well, and we will be engaging. I just want us to be mindful that we are still in a crisis of an outbreak. I can safely say that from the information I have received, this is no longer about family clusters, but rather we have in transmission. And with that in mind, citizens, residents, you have to do your part to help us. This is no longer just about the task force, Ministry of Health. This is not just the government. This is everybody. We have to go back to that all-inclusive approach that we once had. We cannot surrender at this time. We have to defeat COVID-19. And that's why I was happy to hear Dr. Padilla speak to the Pfizer and the effects, that there are no effects in our children recorded so far. And we are hoping that that continues, and that should motivate you to come out, bring your children who qualify for this vaccine, and let us get them vaccinated. If you need us to help you in transportation, call us and let us get transportation to take you from home to the health centers or wherever it is, and get you vaccinated. If you need Dr. Wilkinson to come and talk with you, he's available. Right, Dr. Wilkinson? We will come and talk to you. If you need Lesroy to come and pick you up, we will pick you up. We are on target that by December, we should meet our target, whereby every inbound passenger should not have to quarantine. That is our target. And we are hopeful that you help us to reach that target by helping us control this present outbreak. I also want to remind you that the British Airways flight will resume services to St. Kitts and Nevis on the 3rd of October. So on the 3rd of October, we will have our first British Airways flight. So you can see that slowly we are attempting to, one, fight the virus while still create more economic activities. While we are still on the tourism aspect of things, American Airlines will begin daily services to St. Kitts and Nevis from the 2nd of November. So we have to ensure that we are prepared for that higher influx, of tourists and travelers that will be utilizing our ports. So we are strengthening our structures that has been put in place, our corridors of containment, and everything else to ensure that we can sustain that influx of passengers. On October the 5th, we will have our second visit by celebrity Equinox. Let me just state that we are going to create the bubble once more, and that bubble will be activated at 6 a.m. on the morning when the ship arrives. So once that ship is docked, that day when the ship is docking, we will be activating the bubble as of 6 a.m. in the morning. So all persons who are qualified to enter into the bubble would know that they will have to go through the screening process when entering the bubble. Those persons who have had challenges in terms of achieving the accreditation to be service providers within the bubble, I am asking you to contact the St. Kitts Tourism Authority so that you can qualify and not wait on the day to see if you can get into the bubble. That will not be permitted. I want to take this opportunity to thank Mr. Gurdip Dev Bath, who has contributed to our national response effort by contributing a 40-foot container of dry food to the Federation of St. Kitts and Nevis. This food will be distributed through the Social Services Department, and I want to commend Ms. Oslin Ward-Harris, who has been doing an excellent job. And I want to make an appeal to persons who have transportation. We're having challenges with transportation. Show us your patriotic spirit. Take some time, volunteer some of your time on your transportation, and help us with the distribution of food to persons around the island who are in need. So if you have the time, please contact me or contact Ms. Oslin Ward-Harris at Social Services. Dedicate some time, contribute some volunteering time to the country, and help us. It will be very important. Now, on the weather, thank God that Hurricane Sam has deviated and has remained a fish storm. So only the fishes have been benefiting from Hurricane Sam. And we also now have the development of Tropical Storm Victor just off the coast of West Africa. And the trajectory for Tropical Storm Victor that will become a hurricane by tonight into tomorrow, will also remain will remain east of us with a northern trajectory. That means, too, that it should remain a fish storm. I want to take the opportunity still to encourage citizens, residents, to prepare for the hurricane season. And let's do our best to ensure that if we are impacted, we can be resilient toward a dual hazard environment of COVID-19 and tropical systems. We have been receiving a lot of complaints and challenges about 311 and also about the testing results. All I am going to ask of you, citizens and residents, to exercise some patience and allow the systems to address your concern. If you have a concern, please contact 311. If you call once and you do not get 311, do not be discouraged. Pause for a few, call back again. If you don't get them, call back again, because our resources are limited and there are a number of calls that come in at once. And when you have all these calls coming in at once, you may call at the time where they're engaged, and you may either get a busy signal or your phone will ring continuously. I am encouraging you to call and call until you get an answer from one of these operators. And they will guide you to the relevant agencies that will provide you with the information that you require or the assistance that you require. As it regards the testing, you would have heard Dr. Wilkinson, Dr. Laws would have addressed that yesterday in the Prime Minister's briefing, and you would continuously hear of the challenges. I am asking you to be patient. We are in a crisis, and in times of crisis, that's where you have to find that spiritual patience for you to be able to, address the situation and await for results. I'm hopeful that we can get this matter resolved as soon as possible. We are going to be doing some sectorial engagement. I've been getting a lot of calls from hotels, yes, citizens. We have seen things on social media. But before we get these things on social media and, spread it, find out. It's important for us to find out, and we will continue to provide you with information so that we can fight the misinformation and the disinformation that is happening right now. So let us remain focused. We are on target to do some great things by now. And December, we have just been commended by the representative of PAHO for the work that is being done in the vaccination. We will continue with the risk communication. You will be informed. We will give you the ability to engage us. Citizens have the right to send in their questions, and we will do our best to answer your questions as well as the media houses. So I want to appeal and thank all the citizens and residents who have shown patience and understanding in the crisis that we are facing right now of this community transmission. Thank you very much, Mr. Williams.
Mr. Samuel, thank you for your presentation. This brings us now to our question and answer segment, and I will start the ball rolling with this question from someone who says that they are a 70-year-old citizen. Now that the UK health authorities have approved a third AstraZeneca or Pfizer shot for people over 50, are we permitted to get a third AstraZeneca shot in the Federation? And how many weeks between the second and third dose? And a follow-up to that, what is the attitude on mixing vaccines?
I want to state here that no one is safe until everyone is safe. And it's important for us to vaccinate everyone who needs to be vaccinated before we move to booster shots. You heard the PAHO representative spoke about how some territories struggling, and the World Health Organization plan was to have 10% of our populations vaccinated in the next month and 20% by the end of the year. Yes, we are doing quite good here in St. Kitts, but until we have everyone who should be vaccinated, we would not be moving on to booster shots. It is not something that we're not thinking about, but we need to make sure that we protect everyone who should be protected at this point in time. In terms of mixing and matching, if one does not have to mix and match, there is no reason for us to mix and match. And so we have more than enough Pfizer vaccines to vaccinate everyone in the Federation who is above the age of 12. We have more than enough AstraZeneca vaccines right now to vaccinate those persons who received their first shot and who are waiting for their second shot. And so we have no reason to mix and match. Mix and match comes in when there's a shortage of vaccines and you're hoping to boost somebody's dose if you don't have the one that they started with currently in stock.
Thank you, Dr. Wilkinson. This next question is from Win FM. Countries in the Caribbean have been giving individual simple data about COVID-19 related deaths. Will St. Kitts and Nevis, when reporting a COVID-19 related death, provide the public with the age, gender, and vaccination status?
I think when the CMO gives her presentation, she normally summarizes the data. The difference between St. Kitts and other regions, our population is very small. And if we had a death this morning, we want to give the family the respect and time to mourn, etc. If we had to give specific information about that death, it's very easy for you to find out who the person is, and then the questions, etc., will start coming in. And so we like to give the family who is grieving time to grieve, but the data will be shared at a later date. For example, we have given you information before about the number of persons who have passed, the age, the sex, the vaccination status. We've said that now of the 13 deaths that we've had, only 2 were vaccinated with pre-existing conditions, which means that 11 were unvaccinated. And so we know from the information that we've been given is that the majority of persons who have died, most of them have been elderly with pre-existing conditions who were unvaccinated. And so what you need to learn from that is that if you have a pre-existing condition, if you are unvaccinated, you need to make sure and you step forward and get vaccinated. There are some persons who erroneously think that if they have diabetes, if they have hypertension, if they have renal failure, that they're not a candidate to be vaccinated. These are the persons who need to be vaccinated, because if you get COVID-19, this can push you over the edge. And so once you have these pre-existing conditions, you need to come forward and get vaccinated. There are very few conditions that will eliminate someone from being vaccinated. And so if you're unsure, you can also seek the information from a healthcare professional.
Thank you, Dr. Wilkinson. Another question from Win FM. The United Kingdom's new travel protocols dictate who quarantines and who does not, based on the country's vaccination program. The UK has approved Antigua and Barbuda, Barbados, and Dominica. St. Kitts and Nevis has not been approved. Can you please explain why and what is being done to get us approved? I don't know if that is so, but Dr. Wilkins, do you have a response to that?
I don't know if someone else here has a response, but I can look into it and give you an answer next time. Okay.
Dr. Wilkinson, for my research, the UK has listed the Covishield vaccine, the AstraZeneca Covishield, which was manufactured by the Serum Institute in India, as approved in its revised travel advisory. And we have had the Covishield AstraZeneca from India here, and that is what it is saying, that the Covishield is approved, and that is the latest in the revised travel advisory. That would take into consideration, of course, St. Kitts and Nevis. Yeah. Yes. The next question is, before it was said that you needed an appointment to get the Pfizer vaccine because of how it was stored. But now it is being said you can walk into any health center and get the Pfizer vaccine. What is responsible for that change?
Okay, there are a number of reasons why we were requesting persons have an appointment when we first started. Number one, this was a new vaccine and the nurses were still getting their grist with the administration of the vaccine. We know that it is stored at ultra cold storage, -80, then -20, and then to refrigerated temperature. Once it is at the refrigerated temperature, it can stay there for 31 days. And so, since we have now gotten an idea of the number of persons and the flow at which persons are coming to the clinic, we have defrosted significant amounts so that persons can just walk in without an appointment. I think that answers it.
Thank you again, Dr. Wilkinson. This next question is in relation to someone coming from the United States who is fully vaccinated and who would like to know what is it that they have to do if they have to quarantine at home.
Thank you, Mr. Williams, for the call. So all, according to our health and travel protocols, all inbound passengers who are fully vaccinated, they have the option of quarantining at home once they meet the criteria without any security. Now, what will happen is that this individual will need to visit the covid19.gov.kn website. They will fill out the form for pre-approved quarantine. In addition to filling out the form, you will have to provide proof of your vaccination, proof of identification, along with your travel itinerary saying when you are arriving into the Federation. The reason for that is when the visit is done, and the inspection is done, and the approval is granted, the letter that you receive of approval for home quarantine will stipulate the date in which you are supposed to leave quarantine and also go into quarantine. And it will be validated by the public health inspectors, or port health, and immigration, as well as the taxi dispatchers, that indeed you are for home quarantine. So that's all you need to do. Go visit the covid19.gov.kn website, complete the form, submit your proof of vaccination, your passport bio page can do, a national ID can do, and proof of your travel dates. And then with that, you should get a call, an inspector will come, inspect your property, you will get a response, and you will also get a letter. Once it's approved, you will get a letter of approval with your confirmation number that you will use to upload into the entry form. That's the KNA travel form.kn. So do that and you will be fine. To upload your proof of vaccination and other documents, you email them to the COVID-19 task force at gov.kn. So in addition to the form, you send that email with that information. We are now in the process of revamping the application process, meaning the form, whereby we're going to collate everything and you can upload everything into one form. So that is what you have to do for now. Thank you.
Thank you, Mr. Samuel. This next question. During yesterday's press conference, the Prime Minister stated that we recently received additional AstraZeneca, Oxford AstraZeneca vaccines through diplomatic friendly association, but he did not elaborate. Can you confirm the source, quantity, and the time we received the last batch of the Oxford AstraZeneca vaccine? And the other question is, yes, it's for Dr. Beria, and it has to do with what's the difference in the technology used between the Pfizer Biontech vaccine and the Oxford AstraZeneca.
I just want to say that globally, vaccines are a scarce commodity. Here in the Federation of St. Kitts and Nevis, we are fortunate that we have vaccines sitting in refrigerators waiting for persons to come forward to take these vaccines that can prevent them from getting severe disease, from being hospitalized, and from dying. We are also fortunate that the Prime Minister indicated that through bilateral conversations, he was able to source extra vaccines. And to me, that is more than enough information for me. We also have said here before that we have never and will never give any vaccines that are expired. And so you can be assured that when you show up at the clinic, the vaccines that you'll be given will not be expired, and that is more than enough information for me. And so I don't think I need to elaborate further on what the Prime Minister said at the press conference yesterday.
So to address that last question, I'm going to go back a bit to discuss how the other vaccines work, and then I'll just highlight how the difference with these other vaccines from Pfizer vaccine. So in the past, all our other vaccines work basically through two mechanisms. We either have a live attenuated vaccine or a virus or an inactivated virus. So what these vaccines do is they present the inactivated virus to your immune system. Your immune system recognize, and this is what we do with measles and with polio, inactivated polio, and other vaccines. Basically, those two are the most ones we've been using ever. And what happens is your body looks at it, recognizes this as a strange object, and develops the antibody. But Pfizer uses a different technology. What Pfizer uses is an messenger RNA. So what the messenger does, rather than putting an inactivated virus, he sends, unless I'm going to put it in a very simplistic way, but I think it would help. He sends a messenger, and he says, look, there's a guy out there named SARS-CoV-2, and he's out there attacking people, killing people, and you need to prepare against him. And then the body is saying, well, so how would I know him? And he said, well, he has this spike protein. And so what am I supposed to do? And he said, look, here is the prescription. This is what you need to do to prepare for this virus. So the messenger gives that message, and the body recognizes it and starts preparing the antibody. Immediately, the messenger dies and is expelled from the body. So it's basically, as the name says, is used, and what the advantage with that is allows that you can make vaccines faster. Because in the other vaccines, you need to actually have a virus, have it inactivated. Whereas with the messenger could work much faster, so the capacity to produce is much, much faster. And I just take advantage to also highlight that one of the reasons precise that this methodology of messenger RNA is not new. Is the scientific world knew about it since, messenger RNA was from in the 60s, and they started using it for other vaccines studies in the 80s. So the scientific world was very familiar with mRNA, but it just happened that having the global commitment and funding for vaccine research to scale it up is that this technology was able to come forward. And now this technology is also being looked at some cancers. We're looking at how mRNA could be used to send message to the body to some cancer cells. So that's basically the difference. I'm hoping I made it clear, I'm not sure.
Thank you, Dr. Omir. I think you did clarify the difference between both vaccines. The Ministry of Health, this question, and Dr. Wilkinson represents the Ministry of Health here. Has the Ministry of Health put a pause on undertaking tests for COVID-19 due to the backlog? And if so, when will these tests resume?
As I said yesterday, we are currently going through a wave, and because of the number of positives that we were having over the last week or so, and the extensive contact tracing that was being done, in addition to the samples for persons coming out of quarantine, outgoing passengers, etc., our labs were having a bit of a challenge. However, we are taking care of the backlog, and very soon we'll be back on track. I'm also happy to say that the Josephine France Hospital lab will be back on stream this week, and so persons who present to the hospital who are symptomatic, inpatients, etc., these persons will be able to be tested at the Josephine France Hospital, and the other labs will be used for the contact tracing and outgoing passengers, and so very soon we'll be clearing the backlog. I apologize for the delay yesterday, and I want to apologize again and let persons know that this is the first time any of us in this world managing a pandemic, and we have seen around the world when cases were surging, the lab capacity, the hospital capacity was being challenged. We are happy that our healthcare system from the in-hospital management has not been overwhelmed. Yes, our lab capacity was being challenged, but we are going to be clearing the backlog just now.
Thank you, Dr. Wilkinson. This next question, can persons do the COVID test at a different lab other than the next-gen lab for travel purposes?
We are using more than one lab. We use the next-gen lab, the Avalon Laboratory, and the QDL lab, but we also mentioned the fact that labs have different capacities, and so the next-gen lab has a capacity of about 150 to 300 tests per day. The QDL lab has a capacity of about 12 to 20. The Avalon Laboratory has a capacity of about 20 to 40, and so you can go to any lab, but the volume that can be done at the different labs is different, and so because NextGen has the greatest capacity, that's where most of the testing is being done, but it's not the only place where tests are being done.
Thank you. When will the new COVID testing capability at Alexandra Hospital be up and running? Can anyone take that? Okay. Right. We will find that out and get back to you, but we can't take that one at the moment. We're seeing many instances where contacts of contacts are unclear, whether they are to report for work or to stay in quarantine. There needs to be clarity with respect to who is required to quarantine, who is a contact of a contact, and what should happen for persons who are contacts of contacts who are awaiting initial results. Can some clarity be given, please? Can a document of clarity be made available, the way employers can share with employees and reduce the confusion?
What I can say with our high vaccination coverage and one that continues to grow, we are going to be fine-tuning our contact tracing program. And I believe tomorrow you will hear the new proposals being announced by the Minister of Health, and very soon we'll be sharing them with the general public. I'm pretty certain by the end of the week you will hear about the fine-tuning of the contact tracing program. Initially, before we were in community spread, we were spreading a very wide web to make sure that the virus does not get into the community. And so we were testing primary, secondary, even tertiary contacts, but now we'll be fine-tuning it and making sure that persons, for example, who are fully vaccinated, even if they were named as a casual contact because they are vaccinated because they were wearing a mask and abiding by the non-pharmaceuticals, there'd be no reason for them to stop working or be taken out just because somebody said that they happen to have had a casual contact with them. So you will be getting very clearly defined protocols as to what's a significant contact and what happens if somebody is vaccinated or unvaccinated and how this affects their work, etc. So these will be out before the end of the week.
Next set of questions are from Vaughan Radio in Nevis. As indicated in the last COVID-19 situation report, we now have recorded 13 deaths. Can you confirm the last 3 deaths? Were they in St. Kitts or were they in Nevis? The person wants a breakdown to know how many were in St. Kitts and how many were in Nevis. The other question, there have been numerous reports in the Federation of students being sent home and classrooms closing because of a possible outbreak of COVID in the classroom. With the recent installation of sanitization checkpoints at the school gate, such as temperature checks, how are persons still able to make it to the classroom setting without being detected by the thermometer? Could you please explain? Well, as far as I know, the thermometer don't detect COVID-19. But, doctor, please.
Yeah, I think of the 13 deaths we've had, 1 has been in Nevis and 12 in St. Kitts. And if my memory serves me correct, the last 3, two in Nevis. Oh, okay, so if my memory serves me correct, the last 2 or 3 were in St. Kitts, but I can get that information for you. Don't forget, we don't have all the information at the tip of our tongue like that, and so we can have that information for you for the next briefing. As it relates to temperature checks, etc., these are just rough screening tools, but one can have COVID-19 and have a normal temperature. And so just because you have someone checking the temperature at the gate, it doesn't necessarily mean that someone cannot slip in there with the virus who is asymptomatic. And so this is where personal responsibility comes in. And if you have a child who you know is a definite contact, is sick, etc., you have a responsibility to keep that child home.
Okay, thank you very much, Dr. Wilkinson. That brings us to the end of our question and answer segment for today. I want to thank all who sent their questions in. I received a number of questions. Some of them were the same, and so therefore, in answering one, you answer all sometimes. So I don't have to ask those. I want to thank Superintendent Cromwell Henry for his presentation, Dr. Marissa Carty for the situation report. I thank the 2 PAHO representatives who are here, Dr. Darlene Omer and Dr. Milton Britton Barillas, who told me that he's from Nicaragua. So if you recognize the accent, then you will know. We thank them very much for their coming here to St. Kitts and Nevis and to working along with the Ministry of Health. I want to thank as well Mr. Abdias Samuel for his presentation, and to thank Dr. Wilkinson for availing himself to answer most of the questions today, as he normally does. I want to continue to thank the media for being on board with us in the management of this pandemic. It is extremely important, the information sharing, and not just information sharing, but the accurate information, scientific information, information that is based on data and not some of the misinformation and disinformation going around. Just a little joke, there was somebody who had just taken the vaccine and was on their way home, and they started to complain that they were not seeing right. They were seeing, they were not seeing things clearly, and it was kind of fuzzy. And they made a complaint and they said, well, look, the vaccination, has me not seeing properly. I'm not seeing well, I just took the vaccine and it has to be the vaccine. And then somebody said to him, well, you need to return to the center where you took the vaccine. And when he went back to the vaccine to complain, he said, you forgot your glasses. On that note, I want to end, and thank you very much to all of you for joining us today for our COVID-19 briefing. Next week, we will be back with another briefing. Until then, I am Les Roy Williams. Take good care.